must remain. 'Cause no matter how far you fly, once you taste it, baby, right here you return to die. Since 62, summer head to greener pastures. In the Big Apple, they want a bite. Though for 50 years, we could have gone faster. To build a nation, we have to fight and fight. I love my country. I shall put it away before party, just like Harvey Boris. Oh no. And I love Trinbago, not Trini to the bone, but the marrow. So when them stormy dark clouds want to threaten white, black and red, tell them tread. Until we get real serious, remove the drugs and all them cokeheads. You see me, I want to see Trinbago moving ahead. I agree, we are still a paradise, built byways to highways, but progress came with a price. Although we excel in culture and sports, along the east-west corridor, our youths they pack up courts. Tell me, what is this great fatal attraction? This love affair that they have with crime. Now one by one they fall a daily extra. Our youths they pack up courts. Tell me, what is this great fatal attraction? This love affair that they have with crime. Now one by one they fall a daily extraction. We've got to save our youths while they're in their prime. Teach them to sing.
This is
Dear Lord, thank you for today. Thank you for your continued grace and blessings. Lord, today I ask for clarity that only you can bring. When everything feels noisy, confusing, and overwhelming, your peace is what I seek. Lord, be my center in the midst of the storm. When my mind is consumed with worry and doubt, lead me to your still waters. In Jesus' name I pray. Amen.
Looking for that perfect accommodation? Well, come to Caribbean Tourist Villa, located at number 7 Methuen Street, Port of Spain. All our rooms are equipped with AC, internet, and access to our lovely pool. Whether you're looking for a personal getaway or family accommodations, Caribbean Tourist Villa is exactly the place to be. Enjoy the ambience of staycation, luxurious rooms, and a well-trained staff. Call us now at 623-9164, 797-2858, or contact us at caribbeantourist.villa@gmail.com. Caribbean Tourist Villa, where your magical moments begin.
Looking for the perfect place to call home? Discover Hermosa Vista, East Trinidad's newest luxury townhouse development. Developed by Eastern Credit Union and meticulously managed by EPL Properties Limited, this remarkable new commercial and residential community, located along San Pedro Trace in Valencia, offers the perfect blend of convenience and style. Don't miss out on owning your dream home. Visit EPLPropertiesLimited.com or call 225-4375 extension 5324 or 5321 today. Hermosa Vista, where luxury meets convenience.
Welcome to Alicia's Palace, your gateway to relaxation, adventure, and excitement. Nestled in the picturesque Lady Chancellor Hills overlooking Port of Spain, we cater to both tourists and locals seeking an unforgettable staycation experience. Our rooms are designed to provide the utmost comfort, ensuring you have a restful and rejuvenating stay. Pamper yourself in our jacuzzi room or enjoy fun-filled moments in our 2 outdoor pools. You can unwind in our bar and lounge or embark on thrilling island tours and experiences. Planning a wedding or special function? Our 300-capacity event facility is the ideal choice to create lasting memories with your loved ones. You can also choose from exciting packages like single-day and overnight packages with your special someone. To book your tropical escape, call us at 624-8553 or WhatsApp 3173843. You can also email us at info@aliciaspalace.com or visit our website at aliciaspalace.com for more details.
From now until May 31st, double the deals and double the possibilities with Eastern Credit Union's Dream Deals.
Feel your future with Dream Deals. Borrow smart, dream bigger, feel that freedom. Renovations, education, clear debt, start investing, double deal combos on your vision. No stressing, feel your future with Dream Deals. Borrow smart, dream bigger.
Get a loan for repairs, education, or both. You can win cash and shares. Dream Deals from Eastern Credit Union, leading the way. Loan subject to approval. Normal lending criteria and special conditions apply. Promotion approved by the NLCB.
Welcome to Caribbean Tourist Villa, your home away from home in the heart of Port of Spain. With over 25 years of trusted hospitality, Caribbean Tourist Villa has been a reliable choice for both business professionals and vacationers. Our guest rooms are thoughtfully equipped with all the essentials for a relaxing and productive stay, and our tranquil pool area is perfect for relaxation after a busy day. We've created the ideal space for you to relax, recharge, and enjoy. Give us a call to book your stay today.
We, the people want hope, opportunities, security, and respect. The people want justice. The people want the truth.
I want the truth! You can't handle the truth!
Hear the truth with Ombudsman Harvey R. Boris, the voice of truth. Can you handle the truth?
I love my country. Ladies and gentlemen, today I have a special program for you. Indeed, today I have the one and only Dr. Batson. Yes, Dr. Batson will be on the program today. He is taking you through a lot of medical information to cleanse you, to heal you, to improve your life. Dr. Batson has been doing this for so many years. I'm truly proud of the work that Dr. Jason Batson is doing for us. So Trinidad and Tobago, I want you now to enjoy the program, enjoy the work that Dr. Batson is doing, and you please make sure and call the number, make sure and get onto Dr. Batson. He has various offices in North, South, and Central. He has various offices, so ensure that you contact Dr. Jason Batson. Ensure that you contact Batson Associates to ensure that you are getting better and healthier. Remember, he is here. Listen, it is easy to get sick, it is hard to get well, but Dr. Batson is doing it well. So ensure that you take the time to enjoy the program and listen to Dr. Jason Batson. Dr. Batson, it's all yours.
So you you suffer from diabetes or high blood pressure, or just in need of a general checkup? Look no further. Visit Batson & Associates Limited, your holistic health experts, for your personalized program of solutions with a range of premium products and services tailored to suit your needs. Come and experience transformative healing with our team of specialists in natural and integrative medicine. Visit us or give us a call today at 222-8261 or 314-9975 and begin your journey to optimal health. And remember, if you think health is expensive, try sickness.
Good. It's a pleasant good evening, guys. Synergy family. Always a pleasure to be in your company, discussing health from a natural and integrated perspective. And this afternoon, we're going to touch on a few issues that we deal with successfully at Batson & Associates, and also entertain some questions that were asked that were supposed to be actually answered on today's program. So the first thing we're going to actually discuss is the aspect of integrative kidney or integrative renal care. So the thing is, we know when you're looking at kidney health, Trinidad and Tobago continues to have some serious issues as regards to that. And when you look at renal issues, you find that persons who are hypertensive are usually the individuals who are more likely to end up with a kidney situation, issues associated with renal failure. There are also some additional diseases or issues that could contribute to renal problem, primarily the issue of diabetes. And at Batson & Associates, we do an integrative diabetic clinic as well as an integrative renal clinic. So those are two of the things that we're going to discuss today. Who are the persons more likely or most likely to end up with renal or kidney problems? What are some of the symptoms that kidney problems or some of that a kidney patient would experience? And of course, what do we at Batson & Associates do? And what are the benefits of actually looking at doing an integrative protocol? Okay, so when we're dealing with kidney health, we're dealing primarily with the organ in the body that basically does the filtering, or basically the filter in the body. So usually, practitioners or medical doctors would normally look for a number of things to determine the health of your kidney. So a conventional blood test is usually done, and in that blood test, they would look at the kidney profile. So they would look at things like your creatinine. So if you have an elevated creatinine, if you have an elevated bond, and then, of course, one of the most important factors that they look for is something known as your GFR, which stands for your glomerular filtration rate. Now, your GFR is going to tell the medical professional which level or which stage the kidney is at. You usually have 6 stages. You have stage 1, you have stage 2, you have 3A, 3B, 4, and 5. Now, stage 5 will be 0 to 15. And then you go as the 1 is going to be like 90 and above, and so on and so forth. So those levels are very easy to get. But the point is, if you're in a situation now where the kidneys, that GFR is stage 5, what are you to do? Now, usually dialysis is recommended, and we know what renal dialysis is. Dialysis is basically you go in on a machine, and the machine is now doing what your kidney is supposed to do. Dialysis sessions usually last anywhere in the vicinity of maybe 3.5 hours, 4 hours, depending on the person that is being dialyzed. Now, this question was primarily asked by someone who is at stage 5. So the question was, if you are at stage 5, so if you have a GFR, a glomerular filtration rate, of 15 and under, could that be improved? And the answer, of course, is yes. And that is something that myself has supervised and other consultants would have supervised over the years at Batson & Associates. There's even up to recently, we have been dealing with an individual. When they came to us, the GFR was 8. Now, 8 is usually an indicator, the doctor said, that is it. 8, you need to go on dialysis. So we worked with the individuals at the Integrative Renal Kidney Clinic, and in working with them in 6 weeks, it has now moved from 8 to 12.5. So it has gone up by 4.5. And of course, as we continue to work and put together that protocol and do the diet and the various aspects or the things that they need to address, we're going to, of course, increase and improve that. So that is something that you could actually pay attention to. You can feel free to give us a call or visit. Keep in mind, at number 98 Main Road, Londonville, Shogunas, we have numerous clinics there. So the integrative renal clinic, as I mentioned, would be for individuals who are looking to improve kidney function, improve renal function. You may have a GFR, and the GFR may be stage 4, maybe stage 5, as I mentioned before, and you want to know if it is possible to improve that situation. And the answer, of course, is yes. And this is something that I've seen on numerous occasions over the 15 years having been in practice, because the kidney is an organ. It is difficult to work with, but it is an organ that requires, once you give it an integrative approach, and you might be asking yourself, what is an integrative approach? And an integrative approach is just that, where you take a number of different aspects into consideration. So let me give you an example. One of the things I mentioned is that if you're having problems with your kidney, most likely, or the persons who are likely to have kidney or renal problems are usually hypertensive individuals, so high blood pressure, as well as diabetic patients. So let's go to the hypertension aspect. Now, you have different types of hypertension. You have primary hypertension, you have secondary hypertension. You also have something known as pulmonary hypertension, which is a very dangerous type of hypertension because it exists in the pulmonary aspect of the circulatory system. So because of that, you find an individual who has pulmonary hypertension or secondary hypertension is at a greater risk of having renal or kidney failure. So the safeguards are usually, if you are hypertensive, you should be testing your blood pressure on a daily basis and recording it. And you would be doing whatever medication that you use for hypertensive or hypertension management. So whether you have calcium channel blockers, beta blockers, you might be using diuretics. So things like your Benadryl, Lasix, or those other things like enalapril, nifedipine, and so on. The point is, when you're looking at treating hypertension now from an integrative perspective, you're not necessarily treating the symptomology. So the high blood pressure is not necessarily the problem. What is the problem? The problem is the original or the root cause of the high blood pressure. And that, of course, is where Batson and Associates comes in. So that particular question as regards to who are more likely to have problems with their kidneys, definitely hypertensive patients. The recommendation is that you should always monitor your blood pressure, even though you may have blood pressure for years, even though you may be taking medication for years, even though you may have been monitoring it for years. It is within your best interest to ensure that you have some sort of regular monitoring aspect of your blood pressure. And the reason for that is because blood pressure is so volatile that it is easy to end up in a situation where you can now have elevated blood pressure levels for an extended period of time, and then you end up in a situation of renal failure. Now, one of the other questions that was asked is, what are some of the symptoms of kidney or renal failure? Now, the thing is, long ago, people used to tell you edema, so swelling of the limbs. You find, you might see swelling in the feet. That is not commonplace. Again, there are a lot of other issues. Sometimes you have problems with various types of rashes on the skin. You may have issues associated with, as I mentioned, when you do those specific blood tests, where you're actually seeing elevated creatinine, elevated bond. One of the things we do at Batson Associates is that holistic or homeopathic aspect of blood or hematology. And with the live blood analysis, one of the things we're actually able to do is determine how bad the damage is from that cellular level, which is very important. So check out that integrative renal clinic located at number 98 Main Road, Londonville. Shogunas, the telephone number is there. You can WhatsApp us. That's WhatsApp only on that 3149975 number. And of course, those other locations, St. James, Red Edge Mall, Davie, which is the corner of Ramsey-Mooch Trace, and the SS Erie Main Road in Davie, as well as Tobago, the Triangular Building in Scarborough, Tobago. So that was the question associated with hypertension. So those of you who are hypertension as it relates to renal failure, let me give you some advice. And you know, the advice is this. If you are hypertensive, as I said, you need to pay very, very close attention. If you look at the research now, especially recently, even in Trinidad and Tobago, we are having more and more cases of persons with renal failure, having to do more consultations with individuals who have a kidney problem. So I'm saying to you, if you have an elevated creatinine, you have an elevated bond, even if you are on dialysis, the integrative kidney and renal center is actually designed in such a way to even improve persons who are on dialysis. So you find you're going to have better blood sugar readings. If you are diabetic, you're going to find you're going to have a more controlled HbA1c. Those are some of the advantages of an integrative program. You would also be able to have improved blood circulation. So you find the recommended amount of medication most of the time it now has to be reduced because you know the body.
Do you suffer from diabetes or high blood pressure or just in need of a general checkup? Look no further. Visit Batson & Associates Limited, your holistic health experts, for your personalized program of solutions with a range of premium products and services tailored to suit your needs. Come and experience transformative healing with our team of specialists in natural and integrative medicine. Visit us or give us a call today at 222-8261 or 314-9975 and begin your journey to optimal health. And remember, if you think health is expensive, try sickness. Do you suffer from diabetes or high blood pressure or just in need of a general checkup? Look no further. Visit Batson & Associates Limited, your holistic health experts, for your personalized program of solutions with a range of premium products and services tailored to suit your needs. Come and experience transformative healing with our team of specialists in natural and integrative medicine. Visit us or give us a call today at 222-8261 or 314-9975 and begin your journey to optimal health. And remember, if you think health is expensive, try sick.
Welcome to Caribbean Tourist Villa, your home away from home in the heart of Port of Spain. With over 25 years of trusted hospitality, Caribbean Tourist Villa has been a reliable choice for both business professionals and vacationers. Our guest rooms are thoughtfully equipped with all the essentials for a relaxing and productive stay, and our tranquil pool area is perfect for relaxation after a busy day. We've created the ideal space for you to relax, recharge, and enjoy. Give us a call to book your stay today.
Looking for that perfect accommodation? Well, come to Caribbean Tourist Villa, located at number 7.
Do you suffer from diabetes or high blood pressure or just in need of a general checkup? Look no further. Visit Batson & Associates Limited, your holistic health experts, for your personalized program of solutions with a range of premium products and services tailored to suit your needs. Come and experience transformative healing with our team of specialists in natural and integrative medicine. Visit us or give us a call today at 222-8261 or 314-9975 and begin your journey to optimal health. And remember, if you think health is expensive, try sickness.
Great, guys. So sorry about that. I think we had a little a slight technical issue there. Good. So the next question I was saying was a question associated with diabetes and the problem associated with eye issues and diabetes. So when you're looking at diabetes, especially if you type 1 diabetic, so a brief overview as regards to what diabetes is. So diabetes is usually explained, or you're told that diabetes is one, an autoimmune condition, but it's also a metabolic issue where the body is not utilizing insulin and glucose the way it's supposed to. If you're a type 1 diabetic, it means you're insulin dependent, which means a lot of the time the body is not producing sufficient amount of insulin, and as a result of that, you have to take insulin injections. Now, when you look at eye health and persons who have type 1 diabetes, one of the things you would realize is that if you are a person on insulin, you have to pay very or more attention to your eyes. And I'll explain to you why that is the case. Having been a consultant on consulting as it relates to diabetes and different types of diabetes, because you have like about 5 different types of diabetes. You have type 1 diabetes, you have type 2, which is known as diabetes mellitus, which is the most common one. And those persons are normally placed on blood sugar medication. So things like your metformin, glucophage, Januvia, Janumet, so on and so forth. You also have gestational diabetes, which is referred to as stage 3, or type 3 diabetes rather, which usually is experienced by pregnant women. And usually you find once that is managed properly, those women usually are no longer diabetic after the pregnancy, but it's just because of the differences with hormones in the body because of that situation of pregnancy that you may have elevated glycemic index or elevated blood sugar levels. You have type 4, which is known as insulin dependent, and you also, not insulin dependent, sorry, what is known as early onset diabetes, and you actually have type 5, which is also known as glucose intolerance. Now, we could speak for hours about diabetes and what diabetes really entails, but one of the things I will advise you, and this is one of the things we do at the Integrative Diabetic Clinic. So, what are the advantages of an integrative diabetic program? One, as I mentioned before, you're going to have better A1C levels. So that HbA1c, which is the blood test that is normally performed every 3 months to give you an average of your blood sugar reading over 3 months, is going to improve. Because we know the readings, they normally, a good reading is anywhere between 5.4, 5.6. That's usually under. We like to be, or like to have you under or below 6. Good. Now, one of the things the advantages you'll also experience is better eyesight. And that comes to the question that I was answering as it relates to how does diabetes affect eyesight. Now, the thing is, remember, one of the challenges with diabetes is that diabetes is very it's very inflammatory. So as a diabetic or someone who has diabetes, it means your inflammatory response is usually higher. It means the oxidative stress in the body is usually higher. In layman terms, what that basically means is that you have poor circulation, you have poor oxygenation in the cells, excuse me, and as a result of that, you find that you're going to have easier cellular damage in the body. So it means that it is more likely for you to develop different eye problems. So if you're a diabetic, the likelihood of you developing glaucoma is significantly increased. Glaucoma is elevated ocular pressure in the eyes, and as I said, diabetes can contribute or further exacerbate that problem. So that's one of the advantages of the Integrative Diabetic Center. You now have, because of that specific protocol that is now addressing not necessarily the diabetes per se, but the root cause of the diabetes. Because you could have 10 persons with diabetes, but you have 10 different reasons why all of them have the same outcome, which is diabetes. So that is an option if you would want to explore something you want to look at. Definitely Batson & Associates is the place to be. Check out that Integrative Diabetic Clinic. Because, as I said, one of the advantages with that is improved eyesight. Persons who are usually type 1 diabetics, so those are the persons who are usually on insulin, and especially if you're on insulin for a number of years, you find that your eye tends to deteriorate quicker. So you might have early issues associated with various eye problems. So you have detached retina, which is bleeding behind the eyes. You could have swelling or inflammatory response at the back of the eyes. You can also have what is known as floaters. You can also experience something known as macular degeneration, which is degeneration of the macula. And there's also something known as age-related macular degeneration, and so on and so forth. So there are a number of eye issues that you can experience as a result of being diabetic. How do you now correct that and make the necessary changes is where Batson & Associates comes in. There's a particular product that we carry called Eye Optics Formula. Very, very popular, pharmaceutically prepared, ophthalmologist recommended. And what that product actually does is improve the circulation in the eyes. Now, the question as it relates to diabetes and eye health, as I mentioned, remember one of the major issues that all diabetics experience, especially type 1 diabetics, are impaired blood circulation. So hence the reason why men who are diabetic usually can end up with problems like erectile dysfunction. With women, you find problems with serious issues with yeast infection as a result of being diabetic because of that elevated blood glucose level. You find yeast usually tends to thrive in the body. So in females, you find that would be an issue. It also happens in men as well, but because of the way women are designed based on anatomy and physiology, you tend to realize that women would experience or show higher levels or levels of elevated yeast in the body. Good. Now, as it relates to that situation, as I mentioned, because of compromised circulation, one of the other major issues that diabetics experience is something known as diabetic neuropathy. So that was the other question. So keep in mind those telephone numbers and locations, those open clinic days, and you can also follow us on our social media platforms. Very soon we're going to have those things for you to be able to see. We are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. On YouTube, we are Batson and Associates Trinidad. And on TikTok, we are Batson and Associates. So back to that particular aspect that I was discussing there. So because of that impaired blood circulation, you now have impaired neurological function. In layman terms, what is referred to as diabetic neuropathy or neuropathy. So the thing is, you can have neuropathy, which is nerve damage, and not be a diabetic, but you also have diabetic neuropathy. So keep that in mind. You don't necessarily have to be a diabetic to have neuropathy, but you can have neuropathy and not be a diabetic. Okay, so that's a very key point to take into consideration. So what does diabetic neuropathy feel like? You might hear different persons describe it in different ways. So one, you might hear people refer to what is known as junjuni, or pins and needles cramping in your calves, burning under your feet. Some people explain it as feeling as if it is you're wearing socks. Others explain it as you feel as if you're walking on water. Some people say, so different ways in which persons may express how they feel, but at the end of the day, it's basically one thing, and that is diabetic neuropathy. And that's one of the things that we treat quite successfully at Batson and Associates at any of those integrative circulation and even wound center. So you can check that out if you are someone who has a diabetic wound. That's one of the reasons why diabetics usually end up with what are known as diabetic ulcers. Now, you have different types of ulcers. What are diabetic ulcers? Diabetic ulcers, in layman terms, persons refer to them as maybe a sore foot. You might see an individual who might have an open wound or open sore. And most diabetics, because of that neuropathy situation, they do not feel when they are injured. So, you know, you have instances or cases where we have seen persons where they could actually step on nails, you can step on a sharp piece of metal and get cut. And you may have gotten cut for days would have passed, hours would have passed, and it hasn't been brought to your attention because you cannot feel. So that is something that we do treat as well at the Integrative Wound Center. What you need to keep in mind is that if you have an open wound as a diabetic, and it's taking a number of years to heal, or a number of months, that is usually an indication of the body telling you that the oxidative stress and the inflammatory response in the body is too high, and you need to improve the circulation from a peripheral perspective. You have different types of circulation in the body. You have pulmonary circulation, which is above the heart. You have systemic circulation, which is fundamentally below the heart. But you also have something known as peripheral circulation, or what is known as circulation in the extremities. So tips of your fingers, the back of your eyes, your brain, the tips of your toes. And you find persons who are diabetic usually have challenges with that. As I mentioned before, those are some of the symptoms to look for: junjuni, pins and needles, cramping in your calves, burning under your feet. And there are a whole host of products that we carry at Batson and Associates to deal with that. We have a product known as Circulation Plus, and more information would be forthcoming in future programs as regard to that. ProNerve is also a really good product, ProNerve and Nerve Restore, to really deal with that nerve problems, with that pins and needles, cramping in your calves, burning under your feet. So that's very important that you address that. Feel free again to reach out to us. Those telephone numbers are below the screen there. You can WhatsApp us on 314, that is 314-9975, and get that necessary information. Good. Now, so the other question that I had to answer was a question based on menopause and hormonal imbalance. So you'll realize we touch in various aspects because, of course, there are many persons out there who have numerous issues, and you might know how to deal with the issue. One of the other topics that I'm going to touch on this afternoon as well is the topic of inflammatory bowel syndrome, or what is known as IBS, or what is known as inflammatory bowel disease. So we're going to touch on inflammatory bowel disease in general, where you're looking at things like Crohn's disease, irritable bowel syndrome, diverticulitis. We also do really good work as regards to that as well, because if you have an inflammatory bowel condition, what you really have is a situation where your likelihood of developing cancer has significantly increased by about 10 times, or has increased tenfold. And the reason for that is because 70% of the immune system lies in the gut. You'd realize a lot of the information coming out now, you hear people talking about gut microbiome, or you might hear just speaking about the gut health. Now, gut health is very important, and this is something that we have been aware of for years. At Batson Associates, we have successfully treated persons with things like GERD, which is the acronym for gastrointestinal reflux disease, or what some people refer to as acid reflux. You might be experiencing excessive amounts of bloating, especially around ladies where you're having your menstrual cycle. That is definitely alarm bells, red flags, as they say, of serious issues associated with gut health. But I'll tell you why gut health is even more important to pay attention to. What a lot of persons are not aware, and you know, a lot of research, if you look at oncology research, cancer research now, you find that a lot of oncologists, a lot of cancer research doctors, a lot of cancer research institutes are now focusing more on gut health. And the reason for that is because they understand now that the immune system fundamentally resides in the gut, but also if you have a compromised gut system, your likelihood of developing cancer is significantly increased. Now, cancer is always a touchy subject, and I say touchy in the sense that when you're dealing with persons with cancer, which I have consulted on numerous occasions, from a dietary perspective, from a perspective of functional medicine, from a perspective of integrative medicine, is that when you're dealing with cancer patients, one of the things a lot of them do not understand is that when you have cancer, you cannot eat every and anything. There are some people who will tell you you can eat everything. That is a serious misconception, is a serious misrepresentation, because that is not the case, because you're looking at a system or a condition where this immune system is significantly compromised. Now, I'll explain to you what that means. It means if you have a severe or a compromised immune system, it means the immune system is not determining or picking up a number of different issues. So persons who this would apply to would be persons who you may have gone and excuse me, you may have gone and done a colonoscopy, and the colonoscopy may have given you an indication, the doctors may have informed you that you have diverticulitis. And diverticulitis is a condition of the intestines where it is considered an inflammatory condition because the intestines actually have specific folds in them. And the thing is, an individual who has diverticulitis, those folds actually have cuts or openings in them. And what you find is that you can actually get infection in there. That is usually not a good indication, because a lot of the times it can later on cause, as I mentioned, cancer. Things like colorectal cancer, colon cancer, prostate cancer, even breast cancer. And one of the things I said a while ago is that all cancers, all types of cancers, all have their root in some sort of faulty immune system functioning. So it's very important, to pay close attention to that. That was the question that was asked there. And of course, those answers you can see on our social media platform. We are Batson & Associates Limited on Facebook. On Instagram, we are Batson & Associates TT. On YouTube, we are Batson & Associates Trinidad. And on TikTok, we are Batson & Associates. You're listening to Dr. Jason Batson, the Senior Medical Consultant at Batson & Associates, where we support your health naturally. So we're having a discussion this afternoon. We're discussing health from a natural and integrated perspective. We have covered 3 or 4 of those questions that were asked as it relates to health. We just covered that aspect associated with gastrointestinal health. So you may, as I mentioned, you may have done a colonoscopy, you may have done a barium swallow, you may have done some sort of, you may have done an endoscopy because you are experiencing GERD, gastrointestinal reflux disease. We also do integrative consultations where that is concerned and actually help to mitigate and significantly reduce the symptoms associated with GERD. And I'll tell you why that is so important. The thing is, if you have gastrointestinal reflux disease, there are a number of reasons why you can have that. But let me just touch on one that is very important and one that I have seen over the years that has caused a lot of problems, and that is what is known as a hiatus hernia. So a hiatus hernia is actually a hernia where the esophagus sphincter, so based on anatomy and physiology, your sphincter, there's a sphincter muscle or a door that actually closes off the stomach from the esophagus. It's called the esophagus sphincter. And like all sphincter muscles, they actually have the ability to open and close. An individual who is diagnosed or who has been confirmed as having a hiatus hernia, what happens is that that esophagus sphincter does not close. So it remains ajar. So it's almost like this. And what happens is that acid from the stomach comes up and it goes in the esophagus and it causes a lot of problems. So you find you have a bitter taste when you get up in the morning. You might find you have problems where you actually feel the acid is actually going up in the esophagus. It's burning. You feel maybe a rawness, that type of thing. What you have to pay attention with that, and that is something that we treat quite successfully at Batson Associates. You can check out some of those products that we carry. There's a product we carry called Digestive Restore and Digestive Balance. And those products, prebiotic, probiotic, is designed basically to bring back that balance in the intestines there and actually help with that issue associated with acid reflux. If it is a situation with a hiatus hernia, it may be some sort of physical manipulation, some sort of physiotherapy might be needed. I have seen that in past cases where, you know, those physical manipulations may have had to be performed together with nutritional protocols in order to correct the situation. One of the things you need to pay attention to is that if you're getting that burning, and the burning is so severe that you have to actually sleep on 2 pillows, 3 pillows, you can't lie down and sleep, you have to sit up while you sleep, then you should get that checked out, because one of the problems that could actually cause is problems where you now have stomach ulcers. And if you don't know what a stomach ulcer is just that, a stomach ulcer. So you actually have an opening in the wall of the stomach, and if that stays there, it can actually form an abscess. And if that abscess ruptures, well, then that could be very fatal. You could be rushed to emergency, and if medical professionals do not get in there quickly and able to actually sort of cordon off, because that's going to cause serious infection. It could actually cause sepsis, where you can actually poison you, and as a result of that, it can be fatal. So, as we always say, or as I always tell persons at Batson Associates, the saying, an ounce of prevention is always better than a pound of cure. So regardless of the issue that you have, whether it is a digestive issue, you may have been diagnosed with Crohn's disease. We have treated persons quite successful with Crohn's disease, irritable bowel syndrome, diverticulitis, as I mentioned, even stomach and colorectal cancer. I had someone recently who came to us, and one of the challenges that they had is that they had a colostomy bag. But the colostomy bag that they were given was the one that is temporary. So based on the seriousness of their situation, the surgical specialist was actually able to give them a colostomy bag and save the majority of the colon. And the intention, of course, is to actually reverse the surgery as some months go by. So they actually came to us to have the blood count, because they had serious problems with lower blood count. And of course, to do a surgery like that, they needed to have the blood count elevated. We also needed to assist in various aspects of actually not only building the blood count, but we had to do some work on the kidney as well as the blood sugar. So we were actually able to do that successfully, and of course, they actually had the surgery reversed. Now, why I'm making mention of that, as I was saying, is that that particular individual was fortunate. Excuse me. Fortunate in the sense that the surgeons were actually able to not remove the entire colon, because there are some persons, depending on the severity of what is seen inside of there, doctors going to have to do emergency surgery, where they're going to have to go in and maybe take out 15 feet of the intestines. Your small and large intestines primarily is about 23 feet in length. You have your ascending colon, transverse, descending, and sigmoid. So a lot of the times, if you have instances where it's in the upper intestines and the small intestines and the situation is dire, then in some instances, they're going to have to take out a large portion of the colon. So if that is also a situation that you're dealing with, feel free to contact us at Batson Associates, your functional medicine specialist, consultants as regards to that particular issues. Those telephone numbers again and locations, we are located at number 98 Main Road, Londonville, Chaguanas. that telephone number you have there. You can also WhatsApp us on 314, that is 314-9975. Debe is the corner of Ramsey Trace and the SS Erin Main Road in Debe. Tobago is the Triangle Building in Scarborough, Tobago. And of course, Red Edge Mall, Western Main Road, St. James. So we're discussing health from a natural and integrated perspective. So the next question I'm going to answer is the question that was asked. And this particular question was asked as it relates to thyroid function. So I'm going to touch on thyroid health a little bit. And the reason why I will touch on thyroid health, is that thyroid issues are becoming more and more prevalent. I remember when 10 years ago, or even 15 years ago, we weren't seeing a lot of men with thyroid problems. Thyroid problems was more sort of isolated to women. So you find you have Hashimoto's thyroid, you could have hypothyroidism, which is low thyroid function. You also have hyperthyroidism, and you have different other in-betweens as it relates to endocrinology and thyroid health. Now, one of the things that research has pointed to is that additional stress. So because we have a lot of stress now, a lot of persons have to work, traffic, stress. You find that as a result of that, men now are having more problems with their thyroid. Now, women usually experience thyroid problems, especially in menopause, and that's something that we are seeing more and more taking place. I remember doing a consultation recently with a female who was diagnosed with Hashimoto's thyroid, but one of the other issues that she had is thyroid nodules. But the thyroid nodules only became a problem during and after menopause. And this is something I've said for years. I've been saying for years. Menopause only ends when you die. It might be a harsh reality, but it's a reality all the same. So what that basically means is that once you're alive, once you draw breath as a female and you have gone through menopause, do not take it for granted that you may not end up in problems. And that is one of the things that we have been treating for years, because for years now I've been telling persons that menopause has over 250 different symptoms, from insomnia, depression, anxiety, weakness, extreme weakness in your legs, serious hormonal disruption, issues associated with mood swings. So you could be good now and then all of a sudden problems. Hair loss is also a serious problem. Problems with even issues associated with brittle nails. You find your skin don't look as the way that it's supposed to. And a lot of women find it hard to believe and understand that is actually menopause. So the thing is, menopause can be problematic in its pre-stage, so during premenopause or before menopause. During menopause itself, when you're actually going through the significant changes, and post-menopause, which is years afterwards. So in other words, ladies, the point I'm making, you could be a female, you could go through menopause at 40 or 45, and you could now be 70 years. And at age 71, you're experiencing hot flashes, you're experiencing vaginal dryness, you're experiencing severe depression, you're experiencing severe anxiety. One of the issues, and this was our other question that was asked, and let me just touch on this quickly before we continue, is menopause. So the question that was asked is, which organ system does menopause affect the most? And in my personal experience, and having treated so many different, or consulted on so many different cases, is the central nervous system. Women are faced with serious challenges as it relates to their central nervous system. Their sleep is seriously threatened, and anyone who knows anything would know that if you're not sleeping well, you're going to have some problems. Because sleep is important. Sleep is one of the body's ability, or what the body uses as a rejuvenative aspect, or to rejuvenate the body. Now, what a lot of people don't know is that when you sleep, the rejuvenation that takes place is also the body's ability to produce neurotransmitters. What are neurotransmitters? Neuro meaning nerve, and transmitters meaning messengers. So primarily, one of the main aspects or the main functions of sleep, apart from rejuvenative work, is also the production of neurotransmitters. So things like epinephrine, neuroepinephrine, serotonin, melatonin, and so on. So the thing is, if you have a challenge with sleep, and it doesn't necessarily have to be only in the case of menopause, but just in general, it means that your central nervous system is eventually going to crash. especially as it relates to the autonomic nervous system, which is sympathetic, parasympathetic. So that's also something to pay very close attention to. We do an integrative hormonal replacement therapy clinic. So women who may be going through issues associated with menopause. And as I said, those issues can be severe from, I remember sitting on a case with someone who just lost all their hair. You know, all her hair just fell off. And that was actually as a result of menopause. So different women would experience menopause differently. And if that is a challenge that you have, at least have a consultation done and let us actually be able to improve your function as it relates to general health, as it relates to that aspect associated with menopause, and most importantly, menopause associated with the central nervous system. One of the things too, as I'll make mention to as well, is even women who have experienced surgical menopause, because there's also what is known as surgical menopause, and surgical menopause is when women would have done hysterectomies. Hysterectomy is the surgical removal of your uterus. You have partial hysterectomies and total hysterectomies. A partial hysterectomy would be where you remove the uterus and the ovaries remain, or total would be where you remove the uterus and the ovaries. In cases of total hysterectomies, you usually find the neurological shock is more severe. So in cases like that, you find women can actually go into immediate menopause, and of course serious issues associated with neurological dysfunction, issues where they can actually have nervous breakdowns as well. So that's something to pay very, very close attention to. So you can, of course, feel free to give us a call. Check out those integrative clinics. So I touched on the integrative renal clinic. So if you're having problems with elevated creatinine, elevated bond, you may have done your GFR, your glomerular filtration rate, and you have, we normally ask that you walk along with those results. So automatically, we already start the ball rolling. And of course, that aspect associated with the integrative, holistic aspect of homeopathy, where you actually look at blood from the foundation aspect, and that's really where the difference lies. You know, it's a matter of looking at different ways and different aspects to bring about improvement in the body, and that, of course, is what you're looking to achieve. Very quickly, let me touch on one other topic, and that was the topic of polycystic ovarian syndrome, or what is known as PCOS. Polycystic ovarian syndrome is a condition that shows a number of things in the body. Now, you find that women who have polycystic ovaries are not always overweight women. And I'll tell you why I'm touching on this particular aspect, because there are a lot of gynecologists that believe that polycystic ovarian syndrome usually has or is accompanied by obesity. That is not the case. Now, polycystic ovarian syndrome is also, research shows, is usually an indication of early onset diabetes, because you find women, especially adolescent young ladies, who develop polycystic ovaries very early. Usually those women show pre-diabetic considerations, and as a result of that, sometimes end up as diabetics in their 20s, late 30s, that type of thing. One of the questions, or something that you need to pay close attention to, is that females' menstrual cycle should not be painful or excessively painful. If that is happening on the norm, or as something that is normal, or something you have gotten accustomed to, then that is some sort of red flag. That is early indication of serious hormonal imbalance. It is early indication of serious endocrine imbalance, because the endocrine system, so things like your thyroid, parathyroid, pituitary, those various adrenals are the driving force of what produces hormones. So the thing is, if you're having a hormonal imbalance problem, then you're going to end up in a situation with polycystic ovarian syndrome, or ovarian cyst, or endometriosis, or adenomyosis, or even issues associated with infertility, right? Because there are some women who could have polycystic ovaries and they become pregnant and carry to term. There are some women who have polycystic ovaries and they are not able to conceive, because I've seen that. And there are some women who have fibroids and they may conceive, but they do not carry to term, and that's because of the location of the fibroid. So you have intramural fibroids, you have pondulated fibroids. So fibroids, you have 5 different types of fibroids, and depending on the location of the fibroid, depending on the size of the fibroid, you might conceive, but you do not carry to term. And of course, we don't even want to go into all the emotional upheaval and stress that that's going to have. That's like you actually losing a living child. And of course, you don't want to have to go through that particular situation. So feel free, of course, to give us a call or visit. Check out that integrative endocrine clinic located at number 98 Main Road, Londonville, Shogunus. That telephone number, of course, you can WhatsApp us on 314. That is 314-9975. Again, that is 314-9975. So last but not least, I'm going to touch on prostate health. So we're going to touch on the men a bit. And one of the questions that was asked is, what is the difference between BPH, which is benign prostatic hyperplasia? So that's an acronym for benign prostatic hyperplasia. And there's also something known as prostatitis. Now, in both instances, inflammation in the prostate is going to take place. So men, you have to pay very close attention to yourself. Keep in mind that there are numerous other tests that could be done. And it's not only the digital exam that can be done. You have different things. You have a PSA, you have your prostate ultrasound. At Batson Associates, at the back of me here, was actually a sample that was taken in the dry blood analysis, that integrative blood consultation to determine the condition of the health of that particular person's prostate, rather. And one of the things that we found, and I've seen this in most, if not all cases, gut health significantly affects prostate health. Now, I'm not saying that all men who have a problem with their prostate have a problem with their intestines, but a lot of them do. So if you have problems with chronic constipation, if you have chronic dehydration problems, so there are some people who do not drink water. For some reason, you forget, you might be busy, you forget to drink water, you don't like to drink water. And those are serious contributory factors to poor prostate health. So the difference, excuse me, the difference, rather, as it relates to prostatitis is infection of the prostate. So usually, if that is a situation, you would be given antibiotics to take. In the instance of benign prostatic hyperplasia, where you actually have swelling of the prostate, antibiotics are usually recommended as well as a usual protocol. From an integrative perspective, one of the things that I have usually seen to assist in that situation is, again, addressing the root cause of the problem. One of the things you also have to pay very close attention to, men, is the type of job you have. So you find men who are auto mechanics, welders. If you deal with chemicals, you might be a jeweler, you might do straightening and painting. Excuse me. Those type of jobs, even gardeners, so you might be doing agriculture, so you might deal with various types of fertilizers and those type of things. You find it is easier because you are exposed to certain carcinogens. Carcinogens are cancer-causing chemicals, that you can actually now be in a situation where you have developed some sort of prostate problem. So again, what we normally recommend, that integrative prostate center, you can give us a visit. We usually recommend that you have a PSA, which is a prostatic specific antigen blood test, which should be no older than maybe a year, so 12 months, and also that particular aspect of your prostate ultrasound. Now, depending on the consultation and how things look and what you may have, then, you know, certain recommendations would be given. One of the things I could say, and this is something that I've seen in my 15 years as a consultant, a senior consultant, is that prostate health and prostate issues can be avoided. One of the major reasons why a lot of men end up with prostate cancer is because they wait too late to check themselves out. So, you know, we have so many things here now that you can actually use, that you can utilize, that would be able to give you an indication of early warning signs. Excuse me. So that is something that you can, of course, pay very, very close attention to. Those telephone numbers are there. And as we always say at Batson and Associates, if you think health is expensive, try sickness. If you think education is expensive. Try ignorance. Check out those integrative clinics. You have those numbers there. WhatsApp us on 314, that is 314-9975, and you can check out those other locations. We are located at number 98 Main Road, Londonville, Shogunus. Debe is the corner of Ramsonwood Street and the SS Erin Main Road in Debe. Red Edge Mall, Western Main Road, St. James, and of course Tobago is the Triangle Building in Scarborough, Tobago. Always a pleasure to be in your company. Remember, do something on a daily basis to make a healthier you. Look at your water intake. Feel free to call Batson Associates, give us a visit, and most importantly, enjoy the rest of your Thursday. Take care, guys. God bless. Until next week.